In today's Doctor on Call segment, we're talking about traumatic brain injuries and how best to avoid them as well as treat them. We're happy to welcome to the show Dr. Yashar Kalani. He's a neurosurgeon with Ascension Medical Group. Dr. Kalani, welcome in.
Thank you. Thank you very much for having me.
First time being here. You might recognize him. He was the neurosurgeon involved in my special report the other night with Officer Zarkashan. So very informative, and it's good to have you on the show.
Thank you very much. I appreciate it.
So traumatic brain injuries, it's Brain Injury Awareness Month. I think a lot of people don't realize how common brain injuries can be.
Yeah, I mean, they're much more common than thought, and the biggest issue is the impact that it leaves on the patient afterwards. In 2019, based on the CDC numbers, there were over 220,000 admissions for traumatic brain injury and over 60,000 deaths. Of those, 16,000 involved children. So really, we're looking at a disease that hospitalizes about 600 people a day and takes the life of about 200 a day. Of those patients who end up surviving, then there's a huge road to recovery that involves a lot of people taking part to help the patient adjust to their new realities, deficits that they may have, and rehab that may be necessary for them to integrate back into society. So it really is a huge social and societal problem.
Kids versus adults versus elders, there's different ways they often get traumatic brain injuries. For kids specifically, where do you often see the most ways for them to get suffer a brain injury?
For kids, I think that the two most common mechanisms are trauma from motor vehicle collisions, so the importance of wearing a seatbelt or having your child in a car seat and appropriately strapped. For children who are involved in athletic endeavors and sports in this part of the country, football obviously is a huge part of the culture. Lacrosse is another. Making sure that they have adequate gear, making sure that there are coaches and parents at the sidelines who are informed with what traumatic brain injury looks like, what a concussion looks like, and being able to allow the child to return to play once they've actually had adequate recovery from an injury, because we know when there is one injury, a second and a third injury can actually compound to make the situation worse and then really lead to long-term deficits in the patients.
What does treatment look like for a traumatic brain injury?
You know, the most important thing is actually prevention. So being able to prevent the injury from happening or preventing a second or subsequent injury from happening. Majority of the treatment options that we have available to us right now are conservative, meaning we allow for rest and recovery and hope that the body's own physiologic needs address the injury. So the classic teaching, and one that we still apply in the intensive care unit, for example, is an environment free of overstimulation, an environment where the patient can rest and recover, because we really don't have a whole lot of tools available to us once the injury occurs. Certainly after severe injury, we have tools in the ICU and surgical tools to be able to decompress the brain and relieve some of the pressure on it. But for most of the milder cases, the treatment is conservative.
We've talked before, and I want to wrap this up with, you know, you don't want there to be a stigma about brain injuries, but, you know, what's the biggest challenge moving forward and maybe not knowing what the person is going to be like if they were before?
As we talked with Officer Zarkashan's case, recovery can take months to years, and really one of the biggest issues is learning how to live with the deficits and how to reintegrate back to society, especially if you got issues like language deficits or behavioral changes that take place after injury.
Awesome. Dr. Kalani, thank you so much for being here. We appreciate your time and your knowledge on this very important topic. Thank you so much.
I appreciate you, Ryan. Thank you.
Well, coming up in our next half hour, a months-long investigation into the problem plagued Oklahoma County Jail is now complete, what the report uncovered.
Still no indictment for former President Trump. I'm Jared Hill with the latest on the hush money investigation, plus what we could see today in another case involving the former president.